On today's Medical Minute, we are here to talk about the myths and misconceptions of healthcare in rural communities, such as this one. We're here in Alla, talking with the administrator of Hartner Medical Center, Mr. Paul Matthews. Thank you for joining us.
You're welcome.
Let's start out with, there seems to be this belief that rural physicians and hospitals don't provide the same quality of health care such as the urban areas. What do you think attributes to this belief?
I think there are several factors that attribute to the myth that rural providers and hospitals can't provide the quality of care that urban providers can. In the past, there lacked resources of investing in up-to-date technology. A lot of hospitals and doctors' offices were in older buildings. There seemed to be a lack of funding to update and provide all this, and then the lack of specialists. Most rural hospitals did not have sufficient specialists to provide care, so the primary care physicians would have to refer to specialists on care that was out of their realm, and that created a situation where many people just would bypass the rural providers altogether.
What has Hartner Medical Center done to improve its image?
Well, the funding has improved. The state and local governments, as well as the federal government, has established funding mechanisms for rural providers to help in keeping the doors open to a lot of rural hospitals and rural providers, and help us recruit rural physicians. Of course, that is constantly being attacked now with the budget crisis. Our rural funding is constantly being attacked and threatened, as well as a lot of other areas. But it has helped in us renewing, renovating our facilities, recruiting good physicians that we're able to pay them a decent wage or a market wage in order to attract them, investing in up-to-date technologies to provide the quality care that our citizens deserve.
And much needed quality health care in the rural communities. Very good. Let's talk about your providers. They seem to be really stable and stable and locally grown.
Well, we've been very successful in recruiting local providers. Dr. Kenneth P. Morter from LaSalle High School has been here 38 years. He graduated locally from the high school. Dr. Brian Smith graduated from Grant High School. All parishes that we serve. We've got Dr. Riaz Chaudhry from Gina, Louisiana, who's been in our healthcare environment for 38 years, and on and on.
And that certainly adds to the credibility here. This has been your ABC 31 Medical Minute at Hartner Medical Center in Alla, Louisiana. I'm Lola Davis-Michels.